I'm Michael Pearson. This is The Human Condition. Today we're talking more specifically about stomach acid as a problem and its solutions for people with imbalanced digestion. Previously we talked about the difference between stomach acid and bile problems with regard to digestion and gas production and bloating. Today we're speaking specifically about the stomach acid. When a person eats food and it goes into their esophagus and their stomach, they will have a churning process and a releasing process of gas to some degree. The stomach normally lives in your left side, just below the nipple line, but above the rib cage. There's a spot right about here on the left side, which is a bubble of air. And everybody that's an adult has a bubble of air in that stomach that's about a golf ball size. And it's actually been named in anatomy. It's called the Meganblas. The Meganblas is just a normal bubble, and it's supposed to be there. And it sits in your stomach right about here, and you can hear it with a stethoscope. You can also hear it when you percuss the person's chest, like this during a physical exam. And we'll do that during our physical exam course. It's easy to auscultate when a person is lying down, and it's easy to auscultate or listen to with a stethoscope when they lie on their right side and you listen to it over here on the left. If a person doesn't have enough stomach acid, they're going to have incomplete protein digestion and incomplete mineral digestion, and they often will produce excessive carbon dioxide, excessive hydrogen gas, and sometimes methane, but that's a little bit later on down in the process of the intestine. Usually it's not so much methane in the stomach, that's later on. So extra gas production causes the stomach to expand. Even though carbon dioxide is heavier than air, it's lighter than water and it's lighter than food. So it's going to float. So it's going to be the highest thing in your stomach compared to all the food and fluids. That will create gas pressure that will press on the valve that keeps the stomach shut from the esophagus. And when that happens, the insufficient stomach acid that's in your stomach can travel through that sphincter, it's called the cardiac sphincter, and go up into the esophagus and burn the esophagus. Now you might wonder, well gosh, why do we give antacids to block acid when a person has heartburn or reflux esophagitis or GERD, gastro-esophageal reflux disease? Well, essentially the person has maldigestion, and all of the literature and all the textbooks will tell you that the most common cause of GERD, reflux esophagitis, or heartburn is hypochlorhydria, which means low stomach acid. So if you don't have enough stomach acid, you produce this gas presses on the valve, and then the moderately and insufficient amount of acid that's in your stomach is not enough. It comes up to a place where the tissue is unprotected from acid, and that acid, however insufficient, can burn the esophagus. And this can lead to a condition called Barrett's esophagitis and other types of problems. The point is, we have not enough stomach acid, which causes gas, which causes release of the acid. And then what do we do medically? Well, we give an antacid to block the acid that's made, or we give an acid production blocker, a proton pump inhibitor, that actually stops the stomach cells from producing the acid. So we don't get the acid in the first place, so it can't leave the stomach and burn the esophagus. But it would be smarter if we could to get enough stomach acid to be able to digest our food. Some advocates use food combining charts, which are an old tradition that can work very well for some people to help them combine different foods, or rather I should say separate foods. It's called food combining, but it really should be called food dividing or food separating. And it's where you separate certain foods from others so that they can be more easily digested. If you have trouble digesting meat and minerals, it would be a good idea to put meat and minerals together and eat them with things like lemon juice or lime juice or raw apple cider vinegar. Those are the main things that are very useful for helping the stomach digest and helping produce acid. Many people will also take zinc lozenges. Now, the reason for this is because there are cells in your stomach called parietal cells, and these parietal cells are the cells that collect from the bloodstream hydrogen ions and chloride ions and put them together and make the hydrochloric acid. This is from an enzyme called carbonic anhydrase. This enzyme exists in your lungs, it exists in your kidneys, it exists in your stomach. And these parietal cells in your stomach, they concentrate this and then they release it along with intrinsic factor, which helps you absorb vitamin B12, into your stomach so that you can digest your protein and you can digest your minerals. So if a person doesn't have enough stomach acid, they'll tend to belch a lot and burp a lot. They'll tend to not digest their protein. They'll tend to have heavy stools that sink in the toilet. They'll have stools that are very, very greasy, like a grease pencil, in that they stick to the wall of the ceramic of the toilet and they require extra cleaning. When this material dries out, it will be hard and need to be chiseled off of the ceramic of the toilet. Very difficult to clean, as opposed to what carbohydrates or fats would do if they are in feces and stuck to the ceramic of a toilet or a bidet. That's very, very important distinction to understand how protein dries. Dries very hard. If any of you have ever washed dishes, ceramic dishes, you'll notice that protein caked on is much harder to clean off than pastry or things with just carbohydrate or things with just oil. The protein is much more sticky. So undigested protein, when it dries, will stick to the toilet bowl. So you'll see also that people's symptoms with this stomach acid problem might be incomplete emptying, constipation, and poor shape to the actual stool. The stool should have the shape of the inside of the large intestine. It should have something called a cast to it. And the cast is the shape of the haustra, or the haustrations, or the folds and the sections between the folds inside the large intestine. So it should look kind of like a quilt. It should have this quilted appearance when it comes out on its surface, and should have a fairly thick diameter. The diameter should be thicker than a pencil or a pen for an adult, and it should certainly be, thicker than a pen or a pencil like this one. If a person has chronically thin stools that are long and skinny like this, that look like they've been squeezed out of a yogurt dispenser or something that's very, very, very thin, we have to warn that person that these pencil-thin stools are often an indicator of pending colon cancer. They're not always, but they are a warning sign and a risk factor. So we would give patients that have this problem with stomach acid, we'd give them helping stomach acid, helpful acids in foods like lemon juice, lime juice, and raw apple cider vinegar to take orally with these meals, like on salad dressing or sprinkled over a meal, over even a piece of meat like fish or steak. We might make sauces which have those in them. Now, if you use less acidic foods like tomatoes, they're acidic, but they're not as acidic as the pH of 2.0 of the lime and the lemon and the vinegar. Those weaker acids are not going to stay acids once they hit the stomach. They're going to be flipped and revert and become an alkaline food substance in the stomach. So tomatoes are not a sufficient acid. Oranges are not a sufficient acid. Grapefruit is not enough of an acid. So don't think that by giving a person tangerines or oranges that are mildly acidic that they're going to actually help stomach acid. Now, zinc will be very useful, as we started the conversation. Zinc is very useful because it helps those parietal cells in the stomach that make that stomach acid using the enzyme carbonic anhydrase. So the patient would take zinc by mouth and they would take zinc lozenges. Now, why would they take zinc lozenges instead of a pill that they would swallow? Well, because when a person is zinc deficient and stomach acid deficient, they don't have the stomach acid required in their stomach to digest the zinc that they would take by mouth and that would go into their stomach. So we want to get that into their bloodstream in an easy way. The easiest way to do that is to make it a lozenge that dissolves against their gums. And if it dissolves against the oral mucosa, it's more likely to go into their bloodstream than if they swallow it to an insufficiently acidic stomach that doesn't have enough zinc, doesn't have enough acid, can't secrete enough acid, can't absorb the zinc, and we get in this vicious cycle. So that's why you hear a number of us clinicians talk about zinc lozenges instead of zinc capsules that you can swallow. The usefulness of this is really, really quite helpful. Some people also take stomach acid pills. They take betaine hydrochloride or betaine HCl, and they take those 1 capsule or 2 capsules or 3 capsules, and they slowly add more and more capsules until they feel a warming in their stomach. That method works very well too, as does the vinegar method and the lemon juice and lime juice method. However, in rare cases, a patient may have an ulcer. Now, more than 90% of ulcers are past the stomach in the duodenum, in the small intestine, but some are in the stomach too, and in either case, a person can have a real pain from drinking some kind of food acid that is normally safe and quite palatable, I have to say, as a chef. Lemon juice, lime juice, and raw apple cider vinegar are some of the most powerful and wonderful things that can be used in cookery. In any case, if they're drank, they can irritate a ulcer. So we want to make sure that we pay attention, that we listen to the patient, and we understand that the most common problem, the most common reason for an ulcer, at least direct reason, is a Helicobacter pylori infection. So we want to assess the patient for a Helicobacter pylori infection, which is usually done by a breath test. Now, why would we not do antibodies in, say, blood or stool for Helicobacter pylori? Well, because about 80% of us carry Helicobacter pylori in significant numbers, that we would have antibodies to it, and we would have a false positive that would tell us, oh, we've got Helicobacter pylori, when in fact we don't have enough of it to constitute the actual finding of an ulcer. So we might get this false positive effect. So if we really want to know if we have a bloom of a large amount of Helicobacter pylori, not just a dull roar background noise that 80% of us have without any symptoms and without any problems as a carrier, we want to be able to know, is the stomach and or the large intestine, small intestine, is the stomach or the small intestine producing this Helicobacter pylori bloom? And since Helicobacter pylori, which causes the ulcer and eats away at the wall of the intestine and stomach, since it produces urea, this urea will be something that will come out in our breath. So when we exhale into a bag, we'll be able to send that bag to a laboratory, and for about $100, a lab can test this to see if there is H. pylori in large amounts in your stomach or small intestine, and if you have an ulcer, and it'll tell us, hey, you need some kind of antibiotic or some kind of natural treatment to help with that stomach problem. Now, some people will have a problem where their stomach produces enough acid, but they don't produce enough mucus to protect their stomach from that acid. And so the mucus layer in the stomach can be produced by taking herbs, and there are several that can do that. There are things like marshmallow root, and there are things like deglycyrrhizated licorice or DGL licorice. What they've done is they've removed the glycerizic acid from the licorice so that the licorice will help make the stomach produce more of this mucus. Licorice is something that can raise blood pressure, and so very often they take glycerizic acid out of licorice to make it something safe for people to take for their stomachs in large quantities, because then they can produce the mucus they need to protect their stomach from their own acid, but they don't have the high blood pressure. So that's the use of DGL. There are other herbs for stomach acid, but they're, the main issue is this real problem of producing the acid. So I like the zinc method. I really think the zinc method is the most important one for really restoring balance, because I'm a believer that mineral deficiency is a major problem in the United States for Americans because our soil is so depleted of minerals specifically. Even though our food is fortified with vitamins, our food and our soils are not fortified with minerals most of the time. And we need minerals to make our vitamins work and our enzymes work, and to make these herbs that stimulate our enzymes, they need the cofactors of these minerals. So let's go back to a little bit of the stomach acid problem and talk about a problem that also comes about called Sibo. And Sibo is called small intestinal bacterial overgrowth. That is a problem where really two things come together. One is there is poor gastric motility. Essentially, the gut and the entire intestine doesn't move along enough peristalsis, which is the everyday action of a wave of contraction starting from the mouth all the way to the other end through about 30 feet of intestine, and moving things in a particular direction. So it's almost like there's a sweeper who's always sweeping things in the direction of out, from here to there in our bodies, and that's called peristalsis. And we're supposed to have these wave-like contractions that happen every so often. Even when we're not swallowing, we're sending these peristaltic waves down our throat and down our stomach and down our small intestine and down our large intestine and all the way out of the body. And they keep things moving in a certain direction so that they don't back up and come the other way. Now, even though the human intestine and mammal intestines can often do some interesting things where they can send material backward and forward, they can have things pass each other, generally there's not a lot of backward flow in the human intestine. However, it is possible for bacteria to work their way from the large intestine, which is a completely different environment, to the small intestine through the ileocecal valve. And the ileocecal valve is between the small intestine and the large intestine. And that's right where your appendix is, which is right over on the lower right-hand side of your abdomen in most cases, although it can be as far as on the left side. But in generally, this valve can fail, and it fails from a lack of motility, it fails from a lack of muscular tone, it fails from too much carbon dioxide, it fails from just a number of deficiencies and factors. And when it stays open, these bacteria can work their way up into the small intestine. And when they go into the small intestine, they reach an environment that's much more rich for them and diverse, and it gives them a whole load of things that they can digest into gas. Those large intestine bacteria that make it into the small intestine will produce copious amounts of gas in the abdomen. And so what will happen is the person's abdomen, their waistline, will expand an inch or two after 3 hours after eating, because the food has to make it down the esophagus, which takes 15 minutes. It takes 3 hours to empty the stomach, and then it's in the small intestine. So once it's in the small intestine, the Sibo process can begin, and that is usually related to low stomach acid, but not only low stomach acid. It's partly related to low stomach acid, it's partly related to poor motility, which we just explained, and it's partly related to this bile problem, which we'll get to next. So that's the end of this part, and we'll do bile next.